It's Valentine's Day, a day full of love and in some cases, lonely hearts. Doctors have a warning though for people experiencing heartache. It's something called broken heart syndrome. WRAL health reporter Grace Haba spoke with a local cardiologist about this very real and largely unexplained condition.
No, I'm not talking about this kind of heart. I'm talking about the one inside your body, pumping and keeping you moving all day long. While the name may sound lighthearted, broken heart syndrome is a very real and sometimes deadly condition. Cardiologists here at UNC Rex say they see patients for every week.
It's been increasingly recognized over the past 20 years as basically a heart event that happens in response to a really strong stressor.
As Dr. Christopher Kelly explains, it could be a physical stressor like an infection or injury, or an emotional stressor like grief after losing a loved one, or a tough breakup that lands you here.
For reasons that aren't totally clear, but probably involve really high adrenaline levels in response to that, your heart can actually become dysfunctional and you can develop heart failure.
It's more formally known as a stress cardiomyopathy. It occurs when the heart suddenly stops pumping properly, and it can often be mistaken for a heart attack.
They can even have in their blood sort of chemical evidence of a heart attack. And so we rush them into the procedure room expecting to be treating a heart attack, but the arteries on the heart actually look normal.
Women tend to be diagnosed more than men, but Kelly says it's still unclear exactly what makes someone more at risk.
It can happen almost at any age. So we see people, in their 20s all the way through their 70s or 80s that develop this. There's unfortunately not one specific thing that a person can do to prevent themselves from developing broken heart syndrome. With that being said, stress in general is a contributor to heart disease because it raises your blood pressure, and we think it also causes inflammation in the body.
Doctors say you should also make sure you're getting enough exercise every week and eating a balanced diet. Kelly says the good news is most people with broken heart syndrome make full recoveries. Now, if you're experiencing any chest pain, shortness of breath, or are feeling lightheaded, take those symptoms seriously and go get checked out. Grace Haba, WRAL News.
February is also American Heart Month, and doctors encourage you to become CPR certified. CPR can double or even triple the chance of survival after a heart attack. To learn more and find a course near you, just look under this story on the Health tab of WRAL.com.